some information about translation support that during this program. So Shivangi?
Yeah, I'll just play the video for everyone to watch. हम चाहेंगे कि इस मीटिंग में सभी हिंदी और इंग्लिश दोनों समझ पाएँ। अगर स्पीकर्स इंग्लिश में बात कर रहे हैं तो आप हिंदी में समझ पाएँ, और अगर कोई हिंदी में बात कर रहा है दैट यू कैन अंडरस्टैंड इट ऑल्सो इन इंग्लिश. फॉर दैट वी हैव समथिंग कॉल्ड कैप्शंस. यू कैन गो ऑन द कैप्शंस ऑप्शन इन योर बॉटम पैनल. आपके बॉटम पैनल में कैप्शन ऑप्शन आएगा. आपके फ़ोन पे भी बॉटम पैनल में कैप्शंस ऑप्शन आता है. आपको थोड़ा उसको स्वाइप करना है. आपको उसको लेफ़्ट स्वाइप अगर करेंगे तो आपको कैप्शंस ऑप्शन मिल जाएगा. Captions on your phone also you will get it on the bottom panel. You'll have to swipe it to reach there on the bottom panel. If you click on it, you get the option for translation. You can choose your speaking language as English if you are the speaker and you're speaking in English, and your caption language is Hindi. This will allow for you to see the captions in Hindi. If you want the reverse, you can do it vice versa. अगर आपको हिंदी में कैप्शंस चाहिए तो आप स्पीकिंग लैंग्वेज इंग्लिश रखें और कैप्शन लैंग्वेज हिंदी रखें. अगर आपको यस, थैंक यू.
Thank you for that, Shivangi. I'd like to start. Basically, we are all very much aware of how social media channels, phone messaging applications like WhatsApp, Telegram, and digital platforms such as Zoom are being used to conduct training and to provide remote supervision and coaching as well to the social services workforce. Today, we are going to launch a series of 5 educational videos on social investigation reports, or SIRs for short, specifically for children in need of care and protection, that Enfold has developed with support from Bosch Global Software Limited, CSR initiative, in partnership with the Directorate of Child Protection, Government of Karnataka, and with illustration and animation by Justice Adda. We have also translated these videos from English into Kannada and Hindi in the hope that they will be accessible to a wider audience across the country. This has been such a wonderful collaborative exercise wherein members from all the program teams at Enfold have contributed in some way. And of course, we've also taken some assistance from AI as well. We believe that these videos will serve as a valuable, engaging, dynamic, and accessible knowledge resource for the social services workforce in India on this vital tool enshrined in the Juvenile Justice, Care and Protection of Children Act 2015, which is designed to aid the child welfare committees in assessing and determining the best interest of the child. By leveraging the visual and auditory aspects of video, training can be made more effective, engaging, and memorable, leading to improved outcomes for this special category of children, a majority of whom hail from extremely vulnerable circumstances, hoping to claim their rights and entitlements from the state as children found to be in need of care and protection. Before we get started, a few housekeeping rules to ensure that we have a meaningful and engaging discussion together. During the discussion, we request all participants to kindly keep your microphone on mute and your videos off. After the panel discussion, we will be opening up the forum for discussion, questions, and comments. At this time, you may raise your hand and we will call you to unmute to ask questions. Please feel free to use the chat box to introduce yourself or put up questions in language of your preference. We will draw the attention of the panelists to the questions in the comment box during the discussion session. Please be respectful and constructive in the chat as well as during discussions. Lastly, please do note that we are recording the webinar. I now would like to again hand over to Shivangi. Shivangi, can you do the needful?
Yes, we're grateful for all of you to join us, and thank you for being here. we have had, as Arlene said, we've had the support of many people joining us today. And we're grateful to Bosch Global Software Technologies. And we're grateful for Ms. Shilpa Deodar, the CSR head of Bosch CSR. She's not able to join us today, but we're delighted that we have Akansha Tiwari, who's the CSR lead at Bosch Global Software Technologies. She drives the company's social responsibility efforts with a focus on shelter homes, and she leads the shelter-based interventions, working with NGOs, government bodies, and internal teams to design programs that promote safety, rehabilitation, and long-term empowerment for vulnerable women and children. We request that you give the opening remarks for the event today. Welcome, ma'am.
Akansha, you're not audible. Kindly unmute. Sorry, we can't hear you, Akansha.
Can you hear me now, Arlene?
Yeah. Yes, we can.
Great.
Please go ahead. Yeah.
Super. Thank you so much, Shivangi and Arlene, for this wonderful introduction and addressing everybody, ladies and gentlemen. Thank you so much for coming on this platform. It is a privilege to stand before you today representing our CSR team at Bosch Global Software Technologies and speaking on behalf of our CSR head, Ms. Shilpa Deodhar. As a thematic lead for shelter homes, I'm deeply committed to the cause of protecting and empowering children in need of care and protection, especially those in care institutions who often face layered vulnerabilities. Today marks a pivotal moment as we launch transformative CSR initiative in collaboration with the Department of Women and Child Development and Enfold Proactive Health Trust. This initiative underscores our unwavering commitment to strengthening child rights and promoting well being through systematic support and innovation. I think this is also the need of an hour. At the heart of today's launch is the Social Investigation Report, or SIR, which we generally call so, a cornerstone in the child protection ecosystem. Time and again, both state and national consultations have emphasized the critical importance of SIRs in achieving the objective of juvenile justice. These reports serve as foundation for the child welfare committees in making informed child-centric decisions, whether in interim or final orders or the development of ICPs, that is individual care plans. However, the preparation of SIRs is not without its challenges, as we all are aware of. Many reports continue to suffer from gaps, generalizations, or biases that fail to capture the nuanced realities of each child's experience. We see this as a vital area for intervention and, more importantly, for the transformation. In response, we have embarked on a project that aims to enhance both the quality and consistency of SIR preparation. Our journey began with in depth research into existing practices, learning from challenges, and also recognizing exemplary efforts. This led to the creation of a robust multilingual training ecosystem, comprising a pioneer video series and now which is now available in English, Kannada, and Hindi. These digital learning tools are designed to serve as public goods, which is accessible, practical, and impactful across the child protection landscape. To deepen engagement, we conducted an in person certification workshop in Bangalore, which included a needs assessment and a review of actual SIRs submitted to CWCs. The workshop empowered 29 professionals from caseworkers to probation officers and NGO representatives, equipping them with the tools and knowledge to produce a child sensitive, legally sound, and context specific SIRs. Our commitment didn't end there. We still moved on. We extended our mentorship support to 8 of the participants, working alongside them as they prepared individual SIRs for children under their care. The hands-on guidance bridges the gap between training and practice, ensuring that knowledge translates into meaningful change on the ground. I would like to extend our heartfelt gratitude to our implementation partner, Enfold Proactive Health Trust, whose dedication and expertise have literally central to this initiative's success. Their role in shaping the vision and execution of this project has been truly commendable. As we unveil these training resources and reinforce our collective capacity to protect children, we remain focused on our legal and larger goal, that is to ensure that every child's voice is heard, their story is respected, and their rights are upheld. I think together, through collaboration, compassion, and continued learning, we can build a more responsive, resilient, and child protection system. I really thank Enfold and the entire CSR team who has brought this up, and also the collaboration with the government, this meaningful impact. And I wish everyone all the best. Thank you.
Thank you, Ms. Akansha, for sharing about the project, and we're grateful for Bosch's support in supporting Enfold in doing this and the collaboration. I would request now Ms. Halima K, who is the project director at the Directorate of Child Protection. She holds an MSW from the School of Social Work, Roshni Nilaya, Mangalore. She began her career with NGOs before joining the Department of Women and Child Development in 1999 as a Child Development Project Officer. Over the years, she has served in various key roles, including Superintendent of Shishu Mandir, Senior Assistant Director, Deputy Director, and Program Manager for Child Protection. I would want to invite Ms. Halima to give the special remarks for today's occasion.
Good morning, everyone. Thanks for inviting me. Am I audible?
Yes.
Early?
Yes, ma'am.
Okay. Yeah, this initiative is both timely and crucial, actually, given the highlight and vulnerability of many adolescents in the child protection system, who often lack access to such essential information in their communities. The program is especially commendable for its dual focus, empowering the children with knowledge about their bodies, boundaries, and rights, while also equipping the staff with tools to foster dignity, self-esteem, and a safe, informed environment. By addressing the common myths around puberty and sexuality, Enfold's work is helping build a more supportive and respectful ecosystem for children and adolescents. The video series on the preparation of social investigation report, that is SR, is an excellent and timely knowledge resource. It plays a crucial role in sensitizing child protection functionaries and building their capacity to carry out this important responsibility with care and competence. Given that social investigation reports can directly influence the decisions of the Child Welfare Committee, this resource has the potential to significantly impact the lives and well-being of the children in need of care and protection. By promoting informed child-centric assessments, this series supports just outcomes for the children in need of care and protection that are anchored in their best interests. And I think in our child protection system, this that is skill in preparing the SAR, it's lacking in our child protection system on both in government and NGO CCIs. I think if the SAR is made properly, as even I attend the training once with the Enfold team, if the SAR is prepared as systematically and as per the training given to them, majority of the children, they can go out of CCI, whether in sponsorship or in any other government support system, so that the number of CCIs can be reduced. So as per Mission Vatsalya, our target is that the children in CCIs, number of children in CCIs should be very limited. Only those who need care and protection, that those only can be put in CCIs. So other children, we can support them in other government facilities, like there are so many we go for the single parent or different community hostels also we are having. SC/ST hostel we are having, OBC hostels we are having, and Morarji there's so many residential schools also. So many good residential schools also. So those children, whether they are CNC or those who are coming to the CWC, once they come to our CCIs, and if we can do the SIR and ICP very properly and very systematically, I think majority of the children we can send out of the CCI. So I hope in the beginning of the year 2025-26, we are starting with a release of so many series of videos about ICP and SIR, and this will help not only in Karnataka, throughout India. So as Mission Vasal is functioning all over India, I think these videos will be very helpful to all the functionaries of child protection system. Thank you.
Thank you, Harima ma'am. Thank you for your words of support and appreciation. And also underlining the significance of social investigation reports and the crucial role of deinstitutionalization. We're really happy that you could join us today. I know Akansha has shared a little bit about the process of developing the videos. I'd like to talk about it a little bit more. We see that the social investigation report is at the heart of the Child Welfare Committee's work. It helps them to understand the life of a child. And they're a very powerful tool that can completely change the course of a child's life. So we see that the SIR in many ways acts as the eyes and ears of the CWC, and it gives them a window into the child's world. When we started to make these videos, we saw that the potential of SIRs. We believe that if social workers have a better practical-based knowledge resource, they will be able to present a more complete and nuanced picture of each child's circumstances and make recommendations that are specific and actionable. We actually started with a needs assessment. We did some interviews and also circulated a Google form among social workers and other key stakeholders to understand the two things, primarily their challenges, what the ground realities are, as well as the best practices that they're already using. We're really grateful for those who took the time to share their perspectives with us. Many of those are on the call today. This helped us get a better picture of what was really happening on the ground. We also reviewed several completed SIRs to assess their quality. We looked at how well the child's voice came through and how detailed the section on family dynamics were, etc. With these insights in hand, we began developing content, including video scripts, that reflected the real challenges and opportunities that we discovered. We also then conducted a training in Bangalore for social workers and protection officers. Our team has also provided handholding support, actually accompanying some of the participants during the visit to families for the purpose of SIRs to help them apply what they learned. The result of all this is a video series that is designed to make important concepts around SIRs both simple and accessible. We felt the tension between ensuring that we got the content right, but also wanting it to be simple as well as accessible. We've tried our best to keep the balance and also want to hear what you think about them once you watch them and use them in different avenues and trainings. In just a moment, I will be showing you a short trailer that gives you a sneak peek into the 5-part video series. The full videos are available on YouTube, and they're already up in English and Hindi and will be soon released in Kannada. We hope that these resources can strengthen the way the SIRs are prepared and, more importantly, bring the children's voices to the center of decisions that are being made about their own lives. The trailer is just a 2-3 minute video, but the entire video series is a 5-part video series, which is available on YouTube, which is around 30 minutes long.
Yeah, we're just hold on. We have a trailer coming up. Shivangi is just getting that into action.
Yes, just a moment. Yeah. Yes.
Don't do your SIR because a CWC has given you an order as part of your job, but do it as a commitment for children.
Section 2, subclause 14 of the JJ Act lists 12 different scenarios which explain who is a child in need of care and protection.
We could have two children coming from the same house, from the same background, but having totally different experiences of that particular vulnerability.
So if you require a very good care plan for the child, rehabilitation, restoration plan, reintegration process, your SIR is a base.
Also, the general comment on the best interest of the child. Again, I would urge and really request all new social workers to please read and understand what does best interest of the child really mean. Yeah?
These 7 elements must be considered while assessing the best interests of the child and making recommendations to the CWC through the SIR.
What we keep looking for mostly is the voice of the child, because the perspective of the child looks very different from the adult's perspective.
For each part of the SIR, go to the right person, right professional.
Keep the child at the very center, talk to the child, and I know that all of us here, including you social workers, are doing what is best for the child.
So yeah, we're sharing the video series on the chat as well. Please feel free to watch it as well as share it with all people who may benefit from it. I'd now like to introduce Arlene Manoharan and also invite her to moderate the panel discussion. Arlene is a trained social worker from Tata Institute of Social Sciences and an expert on child protection with 35 years of experience, committed to interdisciplinary, grounded action research, engagement with issues relating to children, policy, and law. She worked with vulnerable children in street situations through various NGOs and subsequently at the Center for Child and the Law, National Law School of India University, where she led the juvenile justice program and also the center itself for a few years. Welcome, Arlene.
Thank you, Shivangi. Thank you. We're now having a little panel discussion, and that will be on the role of social investigation reports for children in need of care and protection, and how they enable child welfare committees to assess and determine the best interests of the child, challenges and opportunities. So, I'd like to invite 3 of our panelists. We have Ashika Shetty, and she is a Feminist Child Rights Advocate, the co-founder and director of Allinclusive Foundation, and a former Child Welfare Committee member of Bangalore Urban. She holds a master's in Gender, Culture and Development Studies and a postgraduate certificate in psychosocial support for adolescents and young adults from the Tata Institute of Social Sciences. With over 18 years of experience, she has worked extensively with children and young adults from disadvantaged backgrounds and contributed to policy and advocacy on rights, education, reproductive health, and safety. And she also serves as an external member of internal committees under the POSH Act. Sister Dulcine is the director and the director of the Resource and Development Center on Child Rights, Shanti Sandesha Trust, Bangalore, and a child rights advocate. She brings 30 years of experience in this field at various levels, initiating and managing programs for women, children, youth, and communities with NGOs and government. She has established 3 social work centers and has organized people through community-based organizations local self-governance subcommittees, and issue-based campaigns as well. She has developed curriculum for social work education and is a trainer, having worked with the government of Karnataka, and is UNICEF consultant and technical expert on child protection. She engages in system strengthening, including on case management and setting standards of care in childcare institutions. Richa is the director, Richa Tyagi is the director, program design and development at Miracle Foundation India, where she drives knowledge creation, quality standards, and thought leadership. With an MPhil in planning and development from IIT Bombay, and as an Atlas Corps fellow with the Grameen Foundation, she brings 20 years of experience in research, strategic planning, and program design, having worked with organizations like FICCI, NIIT Foundation, and the Delhi School of Social Work. A very, very warm welcome to each one of you, and thank you so much for sparing the time to be with us on this panel today. We are indeed grateful.
Thank you. Thank you so much.
Thank you. So I'm going to start off with a question to you, Sister Dulcine. You have conducted training on social investigation reports for a number of the functionaries. What are the gaps that you have observed in the preparation of SIRs? And do you have any recommendations for how to address these gaps? Can you please?
Right, yeah. Good morning, everybody who are on the panel and also joining us for this webinar, for this launching ceremony. I thank Enfold for taking this step, because a lot of trainings we give, but it's not sufficient every time, because there's a lot of turnover of the staff in child protection. People stay for 3 months, 1 month. People stay also for 15 years and 16 years. Now child protection is in India. It's not just in Karnataka. Throughout the country I have traveled, and that's what I have seen. The gaps what I share here, not just from Karnataka, also other states. The one of the best state where the things are happening are Jharkhand. Jharkhand things are better. But in Karnataka, the training part has happened a lot. More than 1,900 people have been trained on 2 phases. Few of them do well, but still there are a lot of bottlenecks and the drawbacks and gaps that we see, because we have assessed about more than 3,000 case files of the children when we visit, with a focus that to better and help make an hand-holding for the social workers, the case workers, probation officers, especially children who are placed in the institution. So one thing what we have observed is CWC, the first part, I'm looking at different aspects. The first one is CWC doesn't give an order for preparing an SIR in right time. Sometimes they give in the beginning. Some people give it in at the end of sending the child out of the institution. Sometimes they make a delay, so there is lot of negative aspects that happen to the child and which come up later. So what is best for the CWCs, as soon as the child comes into the system, like brought before the CWC or for JJB it is, they have to give immediately the order for preparing an SIR. So that earlier is better to understand the child, so that earlier, as early as possible, we do a best order for the child for its rehabilitation or for restoration or reintegration, what has to happen with the life of the child. Because childhood doesn't wait, as it has to be waiting for a social worker or a CWC. Because for us, it may be a day or a month. But for child, it is its childhood. It can be lost within a day or within few hours. So it's very important. Secondly, in some districts, what I have seen, SIR order is done to the DCPU. Because I am speaking from the CWC perspective, these are the 2 main gaps. DCPU. And DCPU has to like do this and entrust to somebody, or most of the time in DCPU staff is engaged in doing SIR. So the gap here is in the act, in the rule, there is a gradation of persons for whom the SIR order for preparing SIR to be given. The first for is a social worker, child welfare officer, or a probation officer, or a case worker, then the DCPU. It's very important to consider this, because many times what we see in the system, the people who are in child protection have come from some other practice, because child protection is new in the country. Therefore, it is our role as CWC or as people in authority with regard to children to make everybody work on this. So that is another aspect. So according to the rule 19, we have to see that it is done accordingly. And by name and by designation, it has to be entrusted, because it is a single person case worker for one child. It's not 101 people come across and child has to speak to everybody. And that one person, the social worker, whom I relate as a case worker, whatever is their designation, the case worker has to do the collaborative work. It is many times what we observe in the process of doing the SIR, they sit across the table and do it. That is not what has to happen, and only engage with the child. Okay, or sometimes it becomes a question and answer thing. It's not a question and answer. The more importance is for engaging with the child and with all the situation that has happened with the child. So yeah, so engaging with the child is very important to respect the participation of the child's view. That is more important. Therefore, collaborative work with all those people who are required to assessing properly the social background or the aspects that made that vulnerability for which the child has brought. Secondly, in the process of SIR, what we have observed is there are so many aspects covered in the format. But some of the things, the social worker thinks this aspect is not required for this particular child. Maybe the child was brought before a CWC for a particular vulnerability. That particular vulnerability may have connected multiple vulnerabilities. Therefore, every aspect and multiple aspects of life need to be explored and in a process of time. Therefore, the act is very specific. It gives minimum 14 days. It is not one-day work. Therefore, don't rush with it. Don't delay with it also. Sometimes it is given 1 month, 2 months, SIR is not submitted. Especially this Halima madam is here, especially the government officers who are supposed to prepare, probation officers, they delay it a lot, which is to be very, very carefully taken into consideration, because the delaying will make the child's rehabilitation, child's care plan delayed. And the care plan delayed, care plan implementation is delayed, and the care for the child will be lost. Therefore, it is very important. Next point is the SIR. I said about the question, insufficient information in the SIR. Sometimes you just tick what is there in the format, or just write yes, no, this information is not sufficient. I always tell in the training, you add extra sheets. You write the story which the child has narrated. It is up to the CWC to decide and assess that story, what exactly child is trying to tell. Because all social workers are not expert to understand child's mind or child's perspective. The CWC, there are 5 people from 5 backgrounds. So they will be able to better assess what aspect is more important, the priority at the time of making an order. Next, the opinion and suggestion which is left. So that is, I think, very important, which Ashika Madam has spoken. Then the summary of the SIR. You see, our SIR format has about 22 pages. It's not easy for the CWC to read all through and make a summary of the whole thing. Therefore, it is very important for the social worker or case worker to make a summary of all the observation together, taking from all the parts. So that is how, these are the main gaps what I have seen.
Thank you so much, Sister Dulcine. I very much appreciate the points that you made, especially looking at children from not just one lens, like suppose it's a POXO case, then we only get into that aspect of the child's life. A child we need to look at holistically from various aspects, and the definition of social investigation report itself highlights that fact. So thank you for highlighting that. Let me now go to Ms. Richa Tyagi. We are aware that Miracle Foundation India has developed resources on SIRs too. Please do tell us more about this so that we can have more people avail of this resource.
Sure. And first and foremost, really want to congratulate the whole team of Enfold and all the supporters in the development of this 5-video series and making it available in the public domain. That's quite a valuable contribution to the sector, and it really, really would be such a wonderful resource for the workforce. So thank you so much for that. And thank you for this opportunity. It was for Miracle Foundation, Miracle Foundation India has been working with a vision of a family for every child in our lifetime. And at the center is really family strengthening. In order to ensure that children are getting reintegrated back with families or family-based alternative care, or to ensure that children do not get separated in the first place from the families. In our experience of work, currently working across 10 states and in over 77 districts, and at the moment it is about 194 CCIs that we are working with and about 67 communities. The work, certainly the approach is really to work with the child protection system, with the state governments and the child protection workforce. Way back in 2018, I'm just... it is resonating what Akanksha said at the outset about the challenges that the workforce faces in filling up the SIR. And Sister just now mentioned that how some of these challenges where it becomes very sketchy when you're just tick marking and not providing those extra details. So at that point of time, particularly when we were working, as part of the case management process, we were aware that these JJA tools of ICP, SIR, case history, they play a foundational role in the whole case management process and the journey of the child towards reintegration. So when we studied these, we found the struggle that the social workforce had to do, the child protection workforce had to do. And therein we then looked at adding certain reference guidelines to the SIR, ICP as well as SIR, particularly we'll talk about SIR here, without making any edits, obviously, to the sanctity of the JJA tools. And it was primarily to look at how do we make the questions more clear. So really bringing insights in some of the areas I'll point out, like the parenting skills, the community support, how's the livelihood of the family impacting the life of the child, the living conditions, how safe are the living conditions, and also what Sister said about stories, how do you really look at the observations of the social workers? How are these coming, particularly towards the end, when you're looking at that, which are the possible placement areas or which will be the right family-based care avenue? So how do you provide those details? And similar work we had done in ICP, of course, there also because of all those areas of concerns and proposed interventions, adding those reference points and checklists, which will trigger the thinking and support the social workforce. So these were, we came to call them as guidelines to ICP and SIR, and in our work across the states, we made it available with the workforce. In Tamil Nadu, of course, the government by circular has included this officially in the work, but in other places also, the workforce is very much referring it. But what we found is that it really helped them, it was very helpful in bringing the clarity in understanding the questions, and also, understanding how to probe better, how to probe better and participate better in engaging with children and families and community, and then be able to look at the course of action. Of course, an integral element was to really build the capacity, facilitate, demonstrate, work with them. So this was an important one of the resource. I'll touch upon 4. One is this. The second one was, as you collect this data, as you do these assessments, child and family assessments, and SIR falling in the realm of family assessment, we also felt it is important for the workforce to then be able to analyze the information which is coming. So how do you look at a kind of a tracker or an Excel-based dashboard? That was called case management tracker then, because you're able to then see the progress that the child is making across each stage of intake, assessment, planning, implementation, and bringing in the creating this tracker referring to the ICP and SIR. So culling out all those pieces from the ICP and SIR and placing it across these stages of case management, and so that they are able to then document it. They're able to analyze what is emerging in terms of what are the needs, what are the characteristics, what are the strengths, what are the challenges, and what are really the priority areas or the red flags to be dealt with, and also able to track the progress. So that was the case management tracker. That was the second piece, which was, which helped to then holistically look at SIR. And of course, the third thing was always about how do we, in our training modules, particularly on the sessions of child assessment and family assessment, bringing in a very comprehensive approach to discuss these tools through or practice these tools through the case studies. And also looking at, there are, in a way, we looked at the workforce, which is more in the leadership roles. So, all those DCPOs, or maybe the CWC chairperson, or sometimes the POICs and ICs, who are like supervising the case workers, or who are more in terms taking decisions, looking at the service design, have actually done it, but now they are supervising a team of case workers. On the other hand, the case workers on the ground, the social workers on the ground, who are working very closely with children and families, actually filling out the ICPs or NSIRs, and closely be involved with the family and children in this journey of case management. So for them to practice, in case of leadership workforce, it is important to see how do you review the quality of the SIR. It is important to see how do you guide my team member in filling a quality SIR, or to help them understand or clarify. So the practice of case studies used to be from that lens, or it is from that lens. In case of the case worker, it is more hands-on from the lens of how do I then engage with the child and family and look at filling these areas. And of course, as Sister said, that it is not just sitting around the table and just talking about it. It is very important to do the family visits. And in this journey of, particularly for a case worker, we have realized, and there are so many instances where how critical it becomes when you engage with the ASHA workers, when you engage with the village administrative officer, and how those cases where the cases of children where there was no breakthrough, now you're able to make sense. Also about how do you look at scenarios where child marriages have got prevented because the social worker of the case worker is working very closely with the family support structure. So these instances we've brought into our training modules also, and I'm glad that we have this video series which we can now very well, which will complement the sessions, and that's the power of collaboration. So that was the third piece. The fourth piece which I wanted to bring in, that in order to complement these JJA tools of ICP and SIR, Miracle Foundation also developed this Thrive Scale tool, Thrive Scale methodology. When I say complement, why? Because, this tool, the Thrive Scale tool actually helped to look at how are we looking at the situation of the family on the fundamentals, whether it is health or mental health, education, the family connection or family and social relationship situations, or the living conditions or the household economy structure, but then also rating it on a 4-point Likert scale of, is the family in crisis? Is it vulnerable? Is it safe? Is it thriving? And then be able to see what kind of targeted intervention or prioritized intervention that can be taken up, considering that there are always keeping the critical safety concerns on top, which we called red flags, and really looking at, these interventions, and of course the progress tracking and follow up. And of course, because in case of Thrive Scale, it is done at a quarterly basis, you can actually track the journey of the child and family until the case is closed as part of the case management. The JJ says 2 years and so on. So these are some of the resources which, in our experience, we developed. And I'm so looking forward to these video series, and I really like the illustrations and the way it's so much like child-centered. So I'm sure that will be a great value addition. So thank you so much for that opportunity.
Thank you so much, Richa. I think I'm so enthused of hearing about the wonderful work that Miracle Foundation India has been doing. And I'm just imagining if I was a child and an SIR was being done for me, the care, the intention, focus, that your tools would help in changing my life. So I really believe that, I hope that you all would also perhaps make a video on particularly this Thrive Scale tool. If that could also be made into,
Yeah, the Thrive Scale tool is now available as a mobile-based and app, web-based portal, and we do have videos. Sure, we are working wherever we have the permission from the government. We are using this app, and I'm sure, like the videos and all, in the making. Yeah.
Wonderful. Really looking forward to learn more. I'm going to move to Ashika. So Ashika, as a former Child Welfare Committee member yourself, looking forward, you've already shared your wisdom in the video that we have prepared, but today I would like to ask you to tell us more. You've always highlighted the importance of the child's right to be heard. Can you share more on why child participation is so critical for a good SIR, especially for, say, children in need of care and protection?
Hi, Aline. Thank you so much for this opportunity, and congratulations to Enfold for another milestone achieved. I'm so glad to be part of that journey. So when I used to be part of the Child Welfare Committee, the one thing that we were looking for in every SIR was the voice of the child. Why were we doing that? Because first thing is, I think that gives us an understanding of the vulnerability from the child's perspective. A lot of what child say and what the child does not say also holds so much knowledge and so much value. We all know how violence and vulnerability is projected on children in terms of their social and cultural norms. Not many of children want to talk against parental violence because of their love that is so complicated around them. And therefore, somebody like a social worker would help us understand what that silence is and what those little words from that child is. So I think one is to understand their vulnerability. I think the next thing is also to make rehabilitation and reintegration a very collaborative process. Now, when we always tell children what to do, we all know how it works as adults, right? But when we sit with children and ask them what they want and help them understand what are the consequences of what they want. I think that discussion has more value than something that we just put down children's throat or tell children that this is what you need to do, right? And therefore, I feel when there is child participation, this entire process of reintegration and rehabilitation becomes a collaborative process with the child as one of the participants. Yeah. And let's not forget that the law expects us to do so. UNCRC is very clear, Section 3 of JJ is very clear that the child's voice needs to be heard. It is the central process of everything that we do with the JJ Act. And like Halima ma'am said, institutionalization is a last resort, right? And that is very key. And how do we get that information? It's from the child itself. Who are they safe for that? What is that vulnerability that has done to me? How do I see myself going forward? What does rehabilitation mean to me? How does it look like to me? What does reintegration look like for me? Right? It might sound very dreamy, but those dreams, and that's our job, right? To make those dreams a reality in a more realistic manner, right? I also feel that when we keep children at the center and we allow children to speak, it also allows us as social workers, as stakeholders in the child protection system, to check our biases when it comes to moral and social ethics, right? It gives us a space to say that, yes, this is something that maybe I ascribe to, that's because of my reality, but this is something very different for a child. And therefore, keeping that away. And when we focus just on the child and the child's views, it helps us in some manner, push it a little away. I also want to add that when we allow for child participation, we also can see, I think I just love what Richa said with regard to how case management needs to be tracked. So when I'm saying it needs to be tracked, an SIR can't be a static document. It needs to be dynamic. And I know Dulcine ma'am also shared how that it needs to be timely. As a singular document. Why can't we see it as a document that can be put forward in multiple stages at the entry level, towards the middle of the rehabilitation, and when we think the child is ready for reintegration? When SIRs are conducted in these different stages, it also gives the CWC that much more tools to make this more an informed decision, right? And lastly, I feel when child is heard, I think half the reintegration and rehabilitation, you've already made that step. So I think child participation is a very key tool for this very, very point, that it makes the social investigation report holistic and keeping the child at the center.
Thank you so much, Ashika. Such valuable points there. And perhaps I'd like to tie that in again, as CWC members, they rely so much on SIRs to give them a window into the child's life and mind and heart, wishes and interests. So how do this SIR play such a vital role in enabling the CWCs to really assess this child more comprehensively, removing biases, blind spots, listen to the child, and then arrive at a determination of best interests? As we know, child participation is one of the 7 elements in the best interest determination process. So thank you for underlying all those points. I'm going back to Sister Dulcine. Very briefly, Sister, we have limited time. I'd like to ask you, we are aware that there are a large number of applications for sponsorship. In Mission Vatsalya, there's now a whole wave of issuing sponsorships. And the question is an SI required for such children? And if so, then how can such a, this additional workload be managed? Sister, you're on mute. Can you kindly unmute yourself?
Whether it is for good or bad, we have received about, I think, about more than 3 lakh applications in Karnataka for sponsorship during this year. From each district, more than 5,000. It's a good sign that we know, we do not know there are so many vulnerable children of one or the other vulnerability. Now, here the aspect is we have to prepare an SIR when I have to decide to give a particular particular care service for the child, because we have more than 39% of children in our country. We do not know who need to be prioritized. So therefore, and we do not have so much of resources also. We don't have money to give for 3 lakh people, because center doesn't give that much money. State doesn't have so much of resource. So we have to prioritize. Therefore, we have to quickly do an assessment of all this, because doing SR for 3 lakh children, it is impossible task for the state government. I'm talking only of Karnataka. Throughout the country, it is the same that has happened. And therefore, what is very important is we prioritize which child need to be done an SIR. So doing an SIR for every child is not possible. Therefore, we have to do a quick assessment of every child who has submitted an assessment. So it could be done by engaging different people, because just now we have very few people in each district who are able to do an SIR. So engaging NGOs, maybe schools of social work, whom we train quickly within maybe 2 to 3 hours webinar, how to do this. And it doesn't contain an elaborative questions. We may have important 10 to 12 fields which we want to understand, to prioritize which child need to be done an SIR. Based on that, we need to shortlist the thing. Maybe it could be done within a month or 2 months with a camp approach. But we have to meet the child and the parent of the child, because it's a single parent or any guardian we have to meet, so that quickly we are able to understand within those 10 to 12 questions. Then what we have shortlisted, those children need to be done in SIR. Because sponsorship is understood in the country or in the state as cash transfer. It is not cash transfer. It is understanding the child and strengthening the child and the family, so that child doesn't become further vulnerable, or that vulnerability which child has is strengthened. That is very important. Therefore, the child which receives sponsorship need to be followed up, whether the child's vulnerability is reduced. So for which SIR is important, and a care plan for that child is also important. So I think I have those things are enough. For if these are 2 strategies they follow, they minimize the number, prioritize to children. The applications are to be SIR. SIR is very important.
Thank you so much, sister, for those valuable insights. I'm going now back to you, Ashika. During your tenure as a CWC member, do you recall any example of an SR that actually shaped the assessment and determination of the child's best interests by the CWC? We'd love to hear a story. Very briefly, though.
Yes, of course, of course. There are so many stories that just come and pop up in your mind, but I think I'll talk about this one case that we had. This child was brought to the committee by the teacher of this child. This child was in grade 8 or 9, and the child had shared that they were going through physical violence in the hands of their father, and they were looking to stay with their grandmother. And when we took the case in, I think the first thing that we did was ask for a social investigation report. And the report gave us a very different view of the entire case. It spoke about how this child had lost her mother a year ago, and because of which the father had gone into depression and was struggling with managing these 2 daughters while he was away at work. Also, there was a lot of property involved in the children's names, of which the others, the extended family, was looking to see how they could, usurp it. And therefore, their way of doing it is to, work their way around with these children. So the children were under the impression that they're safe adults now with the grandparents, because there was no disciplining, there was no, hitting and violence from there, but that's what they see with the father. So what it helped us at CWC understand that there were multiple dimensions to it. One is that there is validity in what the child had expressed. Yes, there is violence, parental violence, that needs to be addressed. Yes, they were feeling unsafe at home because of that parental violence, and the fact that this newfound love that they have with their grandparents, something that they needed to unpack. And I think our rehabilitation process involved therapy for the children, counseling for the children, also involved counseling with the parent, parental counseling, also involved getting the children to understand the situation. And it was so heartening to see how the children actually towards the end broke down and said, we realized that before mom had passed away, dad was so different, and now we know exactly where he was coming from. And also to hear from the father saying that I really didn't know how else to take care of these children. Nobody told me how else to take care of children. And therefore I feel that social investigation report, and I think the empathy of that particular social worker who went there and saw these little nuances, captured it and brought it in a report, helped us navigate the situation for these children and ensure there was reintegration.
Thank you so much, Ashika. I think your story also helps us to realize what the CWCs also have to face. And, you have to empathize and understand and analyze and then make really sound decisions that impact children's lives forever in very, very serious ways. So how a well-done social investigation report with those nuances that help you to get a window into a very private space of a child's life at home and a child's world. So important. Thank you for that story, Ashika. I'm going to now move to Sister Dulcine. This is our last question in the panel, and but we're going to go to an open house. So, Sister, in 2 minutes, do share some concrete tips for how individuals preparing SIRs can play an important role in restoring and enhancing the dignity of a child while performing this important role.
Every social worker or case worker have to understand the moment the child is before the judges system, in whatever small way, there is a loss of dignity in the life of the child, because some right of the child, for me, right is equal to dignity. Any right is affected is the dignity is affected. And it is the role of the whole judges system to restore back that dignity. And if somewhere it is not affected because of any small vulnerability or vulnerability of the family, enhancing the dignity of the child is very, very important. So one aspect is the moment the child is before the judges system itself, child is feeling so vulnerable before the judges system, even if so friendly CWC, but still they feel vulnerable. Therefore, it is very important to respect the child, respect the privacy of the child, and be very kind to the child because child is feeling vulnerable. So that is one of the aspects. So therefore, no force on the child, whatever it is. You want any important information, whether the CWC has said, JJB has said, police has said, anybody has said, don't force the child to bring out the information you require. Child has its own time and space to reveal or share the information. I don't say it is revealing, but it is sharing of the information when the child wants. Because when I, as a professional and adult, I don't want to share anything and everything with any of the things, even with the friends, even with family members. We don't share everything. So child, there is no requirement that child has to share everything just because the child is before the CW. So respect the child first of all. Secondly, and respect the privacy of the child. Child can keep anything out of sharing. Secondly, you give space for the child and understand the respect for the child comes from the way you respect yourself. So if you do not respect yourself, you will not be respecting the child also. So when we understand those small things, whatever I do is for the child. Child is at the center of my whole doing, whether it is SIR, I'm talking to the child, anything. It is child is at the center, not my job. Okay, not the salary that I am receiving. Sometimes they weigh it, we are given only 18,000, 19,000, 20,000. That's not. Child's life is not 18,000. Child's life is life is, we can't value it. It is so precious. So we have to know those things. Secondly, enhancing the dignity of the child is required, identifying the right point where the dignity is hurt, not beating around the bush. Therefore, identifying the right point where the dignity is hurt is very much required, for which you sit across doesn't happen. You do it one time, it is not sufficient. You take time, maybe after 14 days. Therefore, I tell also to the CWC, whatever insufficient information you require later on, it's not once the SIR is submitted, SIR is over. You ask again, write in the note sheet that you require this and get it from this particular professional, this particular person, this particular avenue. So it's important. It's not a one person respecting or protecting or enhancing the dignity. It's the whole college of people, professionals who are engaging with the child. But as a caseworker, it is very important. Thirdly, protect the data that you have received from the child. You do not, child has not given you the carpet permission to tell it with everybody and doing like no proclaiming it from the top of the house. Don't tell everybody that this case is that, this case is that. Don't tell. For that child's that situation is something precious. Maybe it is vulnerable at that time, but when the child grows old, when there is a better situation, child may understand that was part of the life. All of us have gone through life and difficulties, but they were part of life. They have brought maybe lot of strength into our life. Lot of vulnerability has taught us lot of things. So therefore, it is very important not to share many things. Confidentiality, not just to keep away. Confidentiality first for yourself. Don't tell even with your family members. So these are the basic. Participation, ma'am has spoken. Thank you. That's
Thank
enough.
you so much, Sister Dulcine. I think this is at the heart of not only SIRs, it's really the heart of
Everything.
No, in terms of really, if children need to experience the juvenile justice system, the child protection system as a friendly space in which their needs, their rights can be realized, then the social worker or the person preparing the SI, that interface to treat that person as a human being with dignity. And to negotiate privacy, you respect the privacy, but you do have to enter into a private space. So how do you do that with gentleness, with confidence, the child, inspiring confidence with trust? Thank you so much. A very, very important aspect of SIRs. So
and the trust of the child, no? Trust of the child.
Yeah.
It's not
really
necessary that every child has to trust us. We don't trust everybody. So gaining that trust is important. If child also can see that I too am an abuser, because child might have seen an abuser, child might have seen a person who is hurting. Child also may see me as an abuser. So trusting. Yes.
Thank you so much. I think that process of trust building is through that respecting dignity, also trust can be built. So thank you for that feast of sharing that each one of you brought to this panel. A deep gratitude to each one of you. I'm going to open this now to our participants. I already see one question and one hands up. So, okay, the first question that I see, I'm going to pose to, this is a question by Ankit Banki. And Richard, may pose this question to you. Ankit asks, as staff turnover is high, is it necessary to use technology, AI, and mobile applications, which are easy to use, for scaling a process of generation of qualitative reports, especially on SR and ICP? And their tracking also needs to be in an online mode. How can that be possible? Is it good or bad? Or how practical will it be? So, Richa?
Is this addressed to me? Okay, all right. Yeah. So I think one is that, as Sister just now said, of course, child safeguarding policy, which is child safeguarding, which is really critical at the heart of when we are working with children and families. But of late, the Digital Personal Data Protection Act has also reinforced that, confidentiality at every level, be it, child, individual, adults, is like for every piece, it is so critical. When it comes to the digitization, yes, certainly, as sister said, look at the 3 lakh applications and the SIRs have to be done, and, how do we deal with that? So certainly technology plays an important role as a tool to support that. And when we are talking about these tools, I think there is even the state governments are now considering to digitize ICPs and SIRs in the process. And what we have found also through our experience of using the ThriveWell app, it certainly, of course, as I said, I am coming with that point of that we have to be very, very mindful of following the processes technologically also to ensure the complete confidentiality and be under the ambit of it. And hence the whole architecture and the structure of the technology or the app has to be like that. But certainly it is an important support for the workforce, because it actually, see why? Because, it's a kind of a collaboration. I'm not saying that technology is replacing the human mind. It is the originality of the thinking and the expertise of the social workforce is at the core of it. But in the case of use of technology, it saves time to collect the data. And I think the more time the social worker or the child protection worker can give to actually engage with the family, engage with the child, instead of doing documentation, instead of filling up the forms, and look at how the interventions have to be planned. Look at how, we can work towards ensuring the family is getting strengthened. While you are able to capture this data fast, it is helping you to analyze and prioritize the interventions. It is helping you to track the progress, to refer that when you're going for the next visit. So that way, the digitization aspect, the AI aspect is a very good piece to collaborate with. Nonetheless, the conviction, the discretion, and the eye and the heart of the social worker is at the core of it. So technology is a supporter, definitely, but it has to be mindfully used and with all the protection and following all what is provided by the law.
Yeah.
Thank you.
One thing,
Please go ahead.
interaction with the child and with the family, it could be the technology may not be so much appreciated.
That is what I
But
said.
maybe documenting,
That
yes,
is what-
sure. Yes.
Yes, yes.
Thank you so much for that intervention. I'm going to move to Abhishek. Abhishek, you have a question? Kindly unmute and you can put your video on as well.
Thank you so much, ma'am. Very nice session. I'm from Delhi. I'm a psychologist. I wanted to ask a very basic question. While working in the field, Ashika Shetty ma'am said that, yeah, while working in the field, it is very difficult to interact with the, children, like having a, one-to-one discussion and letting them know what is good for them and what is not good for them, or what is less good for them, basically, especially in the CWCs, or, the children in need and care and protection, also in the juveniles and, juvenile offenders, but still. So can you give us some hints or, some examples or some, techniques? How do we do that? How to put the child into a discussion in a constructive way? Because most of the times, children are not aware of the good things about them or about their, future plans.
Ashika, would you like to give that a go?
So I think more than good and bad, I think children struggle to understand consequences, long-term consequences. And that's where they struggle when we give them certain options that don't align with what they are thinking, right? Because we need to recognize one thing is that children are surviving through their vulnerabilities. It may look very off to us, but at that point in time, I don't know if I would do any better. That is something that we need to understand first. I think secondly, we also need to explain what this social investigation report really is to the child in the language that the child understands. It's not a tool to find out what has happened. It's a tool to support the child's reintegration and rehabilitation. I feel that a lot of times when we look at this word investigation, we get a little, overwhelmed, and we kind of trip on the other side and think that, oh, we need to find the causes and the effects. And I'm sure all social workers are coming from a great place in their hearts. But what it actually ends up doing is trying to pit you against the child. So it's the focus is to actually work with the child, trying to encourage the child, saying that, this report I'm doing is to help you get out of this situation. So what do you think? So when we listen to them first, there's a high chance that they listen to us as well. Half the time children don't listen to us is because we don't listen to them. I think once we break that barrier, and we need to also convince them. I think as adults also, I don't think I will do something that is out of my realm of moral and social, norms and structure that I have built in my mind. And so why are we having that expectation from children as well, right? So I think that we also need to slowly, that process is very slow. We need to do it slowly with the child, and alongside also bring different narratives of the child's lived realities, and try and show the child, say, this is what is happening. When you do this, this is what is happening. Not that you have done something wrong, but this is what has happened. This is what the consequence has been. What do you think? How do we engage with this? How do we think we want to navigate it better? And I'm not saying we're going to get a positive result just because we've had these great ideas. We are going to stumble, we are going to fall, the child is also going to fall. And this is a constant process. It's not something that is very, carved in stone. This is the process that keeps evolving. And I think for us to also understand that children will keep continuing to falter, and we need to be there to continue to help them and navigate to that situation.
I just wanted to add to that, if I may, to Abhishek. Abhishek, also, I think I feel that, adding to what Ashika has said, it is also important to build the agency of children and youth. So, for example, I'm giving example of, let's say, the children's clubs or the Bal Panchayats at the community level. In our work, and obviously, this is both applicable for reintegration of children as well as prevention. Like, when you're reintegrating, you're doing the SIR, you've also ensured that the children do not come back to the CCI. So one thing which we found very helpful is to have these children's clubs or these Bal Panchayats getting stronger. We also have we have youth ambassadors, children with lived experiences who are coming out of the system. They are, of course, pursuing their careers and all, but then they also are then choosing to stand for this cause, and then they are going and talking out there with other children, and they are engaging with this workforce. They are visiting them with in the family visits. So we found when the children talk to the children, and then that is what it is. Not for us to do everything. Children are if you are building the agency, we find miracles happen. And how the Bal Panchayat is talking to the DCPU office about street light in my area, about children are not coming. So of course it's a journey. It doesn't happen overnight. But when we see that they are building up, their leadership is gearing up, they talk about those things, and it is so heartening to see that we are not no one to provide all the solutions. So I think that is also very critical, what Ashika is saying. When we talk about children's voices, it has to be done at various levels. So yeah.
Thank you, Richa, for that. I'm going to go. We just have about 9 minutes left. Azhar, Ali, would you like to come in, please? You had put your hand up and down. But
Thank you, ma'am. Thank you so much. Myself, Azhar, CWC Balia. Some good practices I want to share, that I am trying to get the manpower from paralegal volunteers for the SIR, and those students who are doing the MSW in my district university here. So I just going to do the agreement with them कि कोई भी SIR करें तो हमारे साथ जुड़ के हम उनका जो MSW फैकल्टी के स्टूडेंट्स हैं उनको भी साथ लेने की बातचीत की तैयारी में हम लोग हैं। दूसरा मेरा सुझाव मैम था कि अगर हम लोग पंचायत लेवल पे जो बाल हितैषी ग्राम पंचायत की बातचीत की जा रही है उस पे एक अलग से अगर कुछ ट्रेनिंग वगैरह ऑर्गेनाइज आप लोगों की तरफ से हो तो वो भी हम लोगों के लिए थोड़ा सुटेबल हो सकता है। थैंक यू।
Thank you, Mr. Ali. I'm going to go to link 2 questions. I think Soni had from UNICEF has mentioned that SIRs can be a significant step in enabling fact-finding on the human rights violations and in the context. And Anandita, colleague at Enfold, has highlighted, sometimes the approach parts of the SIR are such that they, in fact, make us think more about whether the child is a victim of a crime when there's an allegation or investigation that is ongoing. How does that work? Especially when it may trigger criminal complaints that may destabilize the child's support system without enough evidence. So would any of the panelists like to respond to this?
I didn't understand the question exactly. I read that question. I think there are two aspects. When we do the social investigation report, there is whether the child is put in a place of victim and all others are perpetrators or something like that, that aspect. There is also a thing which is to understand there are various components or the parts in an SIR to understand which vulnerability is more and what should be the priority in making any decision, whether rehabilitation, restoration, repatriation, what is important at that point. So there are, therefore, I think all of us have spoken that we deal with the child, with the family and the situation of the child very carefully, not casually. Okay, that one aspect is very important. Therefore, no one is victim here or somebody is perpetrator. Okay, all that is a situation we have to understand. Unless there is a systematic violence that has happened on the child, maybe a family that happens, it is a certain kind of vulnerability. Family itself is in vulnerability. So it is up to the social workers to how to understand that. Therefore, the different part are to be understood from that perspective, which will help the social worker. So each part has its own importance. Each part has to be dealt from that perspective. That is what.
Sorry to rush you, sister. We have a few more questions and just 5-6 minutes left. So basically highlighting that the focus needs to be on the child and the circumstances of the child and not use it as an investigative tool to identify facts related to the crime. So just underscoring that, I'd like to go to Sumati. Sumati, you've raised your hand. Would you like to ask your question, please? And can we have it a little brief so that we can squeeze in all the questions and have a few answers too? Thank you.
Thank you. That I have a question regarding this SIR and this sponsorship. Really, we have a 3 lakh applications for the sponsorship. Of course, we have to look at it very seriously and we can talk to the government if SIR genuine and if they can approach the government. Like at least for 1 lakh, we can ensure with the government or with any other CSR, any through that within the district itself. But the SIR should reflect that vulnerability. I'm not doubting the thing because after the COVID, after the changing the situation, climate change, everything is impacting on children. So that that vulnerability is increasing the children. That is one thing. But I have a doubt, or I don't know what to say, that about that filling of capacity of the filling of the SIRs that that I have seen. I worked with few districts in Karnataka, but that social worker or professional officer POs are there. They are taking their whims and fancies, like their own caste, their own relatives, just pushing the sponsorship applications. I don't know how we are going to scrutinize those kind of things. That is also there. That is also reason for increasing the number of applications for the sponsorship. These are things I wanted to say. And I really worried about the abilities of the social worker or professional officers to give the additional sheet on this story. Really, they understand the vulnerability and situation of the child. If so, they can do better things. Thank you.
I think there's a lot for all of us to do to enable the strengthening of the system. May I go to Kavita? Kavita, what's your question, please?
Hi, Arlene. Thank you, and congratulations to Team Enfold and Bosch for coming up with this such a wonderful series. So my question is to all the panelists. I just heard ma'am saying that there are if you have received like more than 3 lakh applications for sponsorship. In Delhi, while working with the POXO victims, I've also come across cases where the CWCs has demanded to give the SIR on the spot, like the first production itself. And sometimes if there is a rescue from like for child labor, and there are 50 or 60 children have been rescued from the factory or something, and then order for the SIR has been given to be given in 15 days for all the 60 children. So just wondering what you suggested, that you've taken like few important aspects rather than going for an SIR for all 3 lakhs. You just suggested that we can do some important aspect what needs to take care of, so that whether the child is need, what are the vulnerabilities, when in such situation, can we also do like a short form of it, and then later on with the time we can come up with a longer version? So any thought on that?
Okay. The short term, this is important aspect to shortlist, so that you approach the children who you reach out with the service who require the most. So to decide that, but once you decide, you shortlist. To make a order or a decision, you have to do those shortlisted children's SIR. SIR need to be done. Uh, During that SIR, all the fields which are there in the SIR form may not be required for that particular child. Okay, at that time you do part of it which require, because as you have done the first assessment, you see that could be done first and submitted to CWC, even without submitting to the CWC, because CWC can do only the recommendation for an SIR. To the sponsorship. Sponsorship approval committee is something different. So even as they in conflict with law, there is a principle of diversion. We can also follow a principle of diversion in cases of family vulnerability for children in need of care and protection. Therefore, those applications and these recommendations could go from the DCPU itself. So that is left to each district or each state how to decide about it. But once you shortlist, you have to do the SIR. There is no escape from it, because we require to reduce the vulnerability of that child even after giving the sponsorship. Just because I have given sponsorship for 1 year or 2 years doesn't mean that vulnerability will reduce. I have to follow it up.
Follow-up is like a critical aspect, which is now being spoken about in the realm of JJ very much.
Thank you so much
for these reflections. I'm just pointing to a comment that Bipasha made, and another group of children in vulnerable circumstances who are not Indian citizens and who are stuck here. And is there they're also being admitted into local schools. So can an SIR be done in a, be creative, trying to respond to the needs of children who are in the system, and how we can use that SIR to really enable decisions that can help those children. There's another question related to adoption, which has come to me. Is the social investigation report shared with the adoptive parents when a child is placed with a new family? Does any of the panelists have any thoughts on that?
No, I think for the in case of adoption, it is the home study report and the child study report. The SIR is not applicable in case of adoption. For adoption, as per the adoption regulations 2000, the latest amendments have also been done. It is the child study report which is provided to the parents, and it is the home study report of the parents which is actually done for the matching to happen. So that's another home study report kind of process.
Yeah. But home study report, home study report is about the prospective adoptive parents. But for the child, the SIR, what happens is all that happens from the child is found. All that, whether you are first you are filing, and if the child is found, abandoned procedure you are doing. you are doing if the surrendered child is there, you are convincing the parent or the mother, one who is surrendering, and that period, window period of 60 days is given, and 60 days are not to sit quietly, and that period is SIR period. SIR doesn't mean only in form number 22.
Yeah, and also because adoption process is as per the Carings portal. So what we are saying about home study or child study reports, this is a process once the the application by the prospective adoptive parents and then the children in the system, and the social worker then carries out the home study report for the parents and the child's study report. But before the child study report, of course, if the child is from the CCI, then the SIR would have happened. It would have really, I mean, all that information, the ICP SIR would have fed into further when these reports are being prepared. And of course, as sister said, that the child has to be legally surrendered if the child is coming from the CCI and has legal parents, and if it is from the special adoption agency, that's a separate case. So yeah.
Thank you for that. I think these are more nuanced discussions that are required, and our time is up. Just would like to conclude by saying that
videos
we are
will
so
help,
grateful for
Sorry?
more videos, absolutely.
Watching
And that's what we're coming to.
Absolutely.
That we at Enfold are churning up some more videos, and perhaps in more languages as well. Today we were able to cater to a few. But I would really like to thank each one of you, Ashika, Richa, and Sister Dulcine, for your time, your perspective, and the wisdom that you brought to this table, drawn from the intensive work that you have done over the years. It was
One
truly
minute. Somebody asked about foreign child.
We spoke about that. Yeah.
Okay.
Yeah, we have to a sense said that yes, we can adapt, be creative, and a shorter version perhaps. So any child who's in touch with the system can be used at SIR as a tool to get into the window of that world of that child, to enable that child's voice to be heard, the child's needs, aspirations, and hopefully communicate that to people in power, whether it's the superintendents, it may not be a formal process, but directly also to this Child Welfare Committee, who may be able to pass interim and final orders. So thank you to all our participants. You were wonderful. Thank you for the time that you have, and hopefully that you'll be able to catch you all soon once we launch more resources.
Thank you, Arlene. Thank you, Arlene, and the panelists. Wonderful discussions. So much learning and sharing. Thank you. Nilima.
Thank you, Nilima ji.
Yeah.
Thank you, Nilima ji. Nice to hear from you.
Nice to hear. Yeah, all of them. So much learning and sharing. I loved it. Many thanks. Thank you.
Bye.
Bye. Bye. Bye.
Thank you, ma'am.